Hi, I'm Andy Lazarus. I'm a primary care doctor in Maryland. I'm just a regular doctor. I don't have anything else to say about that, right, Alan? But I'm with my good friend Alan Roth, who will tell you about himself. And we both have written a book, Return to Healing, which talks about our medical system, its origins, and how we can fix it. And a lot of people don't know it's broken, which is part of the problem. So we're also going to explain that a lot of what you're being sold as proper care is actually fairly improper care and also can be dangerous. And there are many better ways to help your health that are a lot cheaper. So Alan will tell you a little about himself.
So I'm Alan Roth. I'm a practicing family doc in New York in Queens County. Uh, Excited to be here talking with you today. I practice medicine, I teach medicine, and I love to write about it. So we look forward to talking with you today. Andy?
And we do want to let you know that we've been what are we about 75 years, 70 years of collective practice between us. We've written tons of articles, books. So we call ourselves the two schmucks, but we have some credentials, but
Well,
mostly it's that we work constantly, Alan and I, and we're seeing patients constantly, and we understand the way the system works and doesn't work. And one of the big things, Alan, that we talk about in our book is how, based on something that happened back in 1911 and how our medicine system became basically corporatized at that point, and we'll talk a little more about that, that people are basically reduced to numbers. I mean, I see it in my practice all the time. People are a collection of numbers. They're, what's your cholesterol? What's your BMI? What's your blood pressure? We got to get it at this number. There, for every number, there's a norm, and for every norm, that norm will change based on the whims of whoever makes those decisions. And when you go to specialist doctors, that's all they care about. You know, they got their little organ of interest, and they just talk about how we're going to fix every little number just right. And what we found, and both in our research and in our lives as doctors, is that's just not a good way to take care of people.
so let me add, the reason we call ourselves the two schmucks is not that we really are two schmucks, is everybody else thinks we are because we constantly get in trouble for the things we say because we're telling the truth. And we're treating people, we're not treating numbers. Okay. It's about the art of medicine. And we're going to talk a lot about the art of medicine in this book. The science of medicine, you could just AI everything right now and it could tell you what to do. But how do you apply that to a human being in front of you that might be elderly or might have multiple medical problems? And young doctors and super specialists are just putting things into their calculator on the phone and starting four medications for four different numbers. And that's not how we practice medicine. We practice medicine by treating people, human beings that have real lives and real families and really suffer many of the adverse effects of all we do to them with medications.
So I'll give you an example that happened to me recently, but it happens constantly. So someone went to a cardiologist, was had a cholesterol done, was put on a high dose of a medicine called statin. So it was a torvastatin 80 milligrams, which is super high dose. He was about 85 years old. And within a month of this, he was having trouble walking. He was also extremely fatigued. By the way, this guy exercises and eats well, and has never had any heart problems. The doctor was just treating a number, and the doctor told him the number has to get below some magical threshold that he pulled out a calculator and determined. And this calculator, as I told my patient, was programmed by drug companies. And pretty much all the calculators you ever see a doctor use were programmed by studies done by drug companies that are given to them. Protocols, algorithms, whatever they say, are drug company derivative processes. So this guy got his cholesterol down, but now he couldn't walk. And that's one of the side effects of this medicine. But the cardiologist was not unhappy about this result. He actually referred him to an orthopedist because now he had leg pain. So as I explained to him, A, that dose of statins is toxic. B, fixing his number is not going to help him. And C, he needs to exercise. And now this medicine has prevented him from doing the most important thing that has kept him healthy. And I see this all the time. I see people overtreating sugars, overtreating blood pressure to the point where people feel sick. And we have tons of evidence to show that none of this helps them, but their numbers look good. And that's what I mean by number treating. It's just become an epidemic, actually.
And if I would never start someone on that dose of medicine unless they were having an acute MI, and that's just temporary, as we know it decreases some of the inflammatory markers during the acute MI, and then you lower the dose or you even stop it if necessary. Again, treating numbers, not treating human beings. And when you add the numbers of hemoglobin A1Cs, blood sugars, and good cholesterols and bad cholesterols and blood pressure, especially as people age, I see we do a lot more harm to people with what we call polypharmacy, which is just treat all the things you have. The residents in the program I have sometimes see a new patient in the clinic that they don't even know they just met, and they have one blood pressure, one sugar, one cholesterol, and they literally start people on 5 medications after the first visit for numbers before they even got to know that person as a human being and what is important to that person, what matters to that person in their life. So with Andy's example, that man's walking ability was really important. Nevertheless, we might be killing their kidneys, killing their livers with that high dose. One of the things I find is many of the cardiologists put people on that statin dose, and then they don't even follow up the numbers, because you just need 80 of atorvastatin and the numbers aren't followed up. And then when you see the patient after the cardiologist, you say, did they repeat your numbers? And it was like, no. I was like, we need to do blood right now because you probably are way overtreated.
And that's the thing is it's there's very little evidence like we talk about in our book that cholesterol matters. We actually have never seen any evidence that cholesterol is an important prognostic risk factor. Just as many people get heart attacks with low as high cholesterol. What Alan's talking about with this particular medicine is it reduces inflammation of the blood vessels. And so when you have an event such as a heart attack, it can calm things down in the heart temporarily. But again, that has nothing to do with measuring cholesterol. It has to do with calming down inflammation and using it smartly. When people are using it to fix a number, then they're going down a bad road. And again, that's what the drug companies want doctors to do. And when we go back, we talk a lot in our book about what's called the Flexner Report. And back in 1911, the American Medical Association, the AMA, the Rockefeller Foundation, and academia all aligned to create this report that changed the way we practice medicine. It changed it more to what we call a Germanic style, where instead of talking to people and finding out about them, we just do a lot of tests and we fix whatever we find wrong. And believe it or not, this was this was the norm, and it erased other more humanistic ways of thinking. So we talk a lot about William Osler, who was around during that same time, one of the founders of Hopkins, one of the great American doctors who detested this method of treatment. And he said, if you want to know what's wrong with the patient, ask the patient. Whereas a lot of people in the system that we use now felt like talking to patients was a distraction. They are too subjective. They're going to tell you stuff, but we don't care what they say because they got their own views. We just need the numbers, measure the numbers, fix the numbers. And I got to tell you, Alan, that's a profitable strategy for our healthcare system to do it that way.
Very profitable. And the other thing, me and Andy actually met at a medical conference, and I've been quoting Osler for my whole medical career, and Andy was the first doc I found that actually did it as well. Like, he was both our healthcare heroes. Like, he was the real doctor and the doctor I always wanted to be, and the doctor I try and be every day. It's about treating humans and not treating numbers. And when you look at the data out there, people don't realize like how few lives are actually saved by so much of the things that we do in medical care. The doctor's going to tell you, if you don't take this drug, you're going to die. But you might actually have a 1% chance of worsening your longevity based on the statistics that are there. But they're, again, treating a number. What they don't tell you is you could have a 50% reduction in dying from this thing, but the initial chance of dying from the thing was like 1%. So now you have, a 0.5% by taking a drug that might kill you if you fall. If you fall and you're on an anticoagulant, you have to spend 48 hours in the hospital just because you fell on an anticoagulant. And most of the people on it just shouldn't be on it. So we could go on, but many of the things we're saying here, you have to realize many doctors will think we're two schmucks.
And that's unfortunately, thankfully our patients don't think that, because we've helped them to live better lives, to feel okay getting off a lot of medicines and not checking tests constantly. And by the way, the reason they were doing it is because A, they trusted the doctor without asking questions. So we beg you to question your doctor. Doctors are not gods, and very often doctors are prescribing a treatment that best helps them. You know, it gives them more money. It gives them more authority over you. But also, you know, the idea too that these doctors wield fear. Like Alan said, if you don't go on a blood thinner, you're going to get a stroke. And in our book, we break down the statistics, and actually, your chance of getting a stroke is higher on the blood thinner than off the blood thinner in many circumstances, most circumstances. And your chance of dying on the blood thinner is definitely higher than off it. But the doctors just make these absolutely obscene declarative statements, and they have their little calculator with them pushing in numbers, again, derived by drug company studies that are very manicured. We talk about this in our book. We go through the process of saying how this thinking started back in 1911 and how people accept it as a norm, which it has become, unfortunately, in the last 25 years. The amount of money we're spending for healthcare has gone from 500 billion to over 4 trillion, and people are living shorter, and people have more disease, and people are more disabled. And no one sees that piece of common sense and asks, wow, we're doing something wrong. Because we don't talk about diet and exercise. Instead, we flood people with drugs to fix numbers. And that's how we end up.
And if you go to parts of the world where they don't use medications like we do, they talk about diet and exercise, or they really don't even need to talk about it that much because they live it. They live from farm to table. They work out there, parts of Italy and Central America and Asia, where people live a lot longer than us, are doing it without their statins and without their blood thinners. And to me, that's total proof of what we're talking about. So last comment for you, Andy, because we have to go, but we'll be back with many more topics over the next months.
The last comment is, you are not a pile of numbers, you're a human being, and just let your doctor know that, please.
Take care. See you next time.